welcome to the Deep Dive. We are returning today to the story of Kenneth Swift Justice Traywick.
That's right. He's the incarcerated advocate at Bullock Correctional Facility, and we're really focusing today on the sheer human toll of his hunger strike.
Last time we talked about the big picture, the massive systemic failures, the staggering financial cost to the state.
But today, our deep dive has a very different focus. It's about the raw chronology of desperation. We're going to follow the steps and, crucially, listen to the recorded phone calls.
These are calls made by Traywick's wife, Dr. Elizabeth Hancock Traywick.
Yes, as she fought against what she accurately described as an impenetrable wall of silence.
So our sources for this, the recorded call excerpts, legal letters, medical documents, they really provide this powerful window into a specific moment.
The moment an institution chooses total isolation as its response to protest.
And it's not random. It's a calculated strategy.
Oh, it is. The institution's goal here was, twofold. First, contain the protest. But second, completely exhaust and silence the only reliable voice advocating for his health and rights.
His family.
Exactly, his family.
So we're asking what the real price is, emotionally and medically, when a correctional system just substitutes denial and silence for basic communication.
And for mandated care. We're not talking about small delays here. We are looking at the critical period around day 12 of a hunger strike.
Day 12, that's when it really becomes life or death.
It absolutely is.
Okay, let's unpack this. So to quickly set the context for you, Traywick, inmate number 1D77252, was protesting things much bigger than his own personal discomfort.
Much bigger. He was protesting escalating retaliation and, truly inhumane conditions, especially in the mental health dorms.
And the breaking point, the thing that actually triggered his strike, came on November 20th.
Right. An officer allegedly sprayed him with chemical agents from behind while he was just sitting on his bed.
And that incident is significant because of who was involved.
It is. It allegedly involved Officer Glover, who was the same officer tied to the well-documented Michael Rouser case. So this history suggests Traywick was being targeted for his advocacy.
So the ADOC's response was, what?
Immediate and just classic punitive isolation.
He was instantly put in restrictive housing on the 20th. And that classification is so key because it systematically stripped him of everything.
Everything. No writing supplies, no tablet, no digital mail.
So nothing that would allow him to communicate or, document his own protest.
Or file legal challenges. It's institutional deafness, basically. It's designed to deter a constitutionally protected protest by just taking away all the tools of communication.
And yet his core demands remain clear.
They did. Very focused on systemic reform.
Yeah.
An immediate transfer, an end to the pattern of retaliation and excessive force, and a face-to-face meeting with Commissioner Ham.
That focus on the big picture, on systemic change, is really important. It validates his wife's fight, doesn't it?
It really does. Her desperation, it wasn't just about love. It was about making sure his body didn't become, collateral damage in a bigger fight for accountability.
And that leads us right into the heart of our source material today.
The recorded calls.
These calls started the moment the strike began, and they track the relentless efforts by Dr. Traywick to just get confirmation.
Just confirmation that her husband was alive, that he was being monitored, and that he wasn't being actively harmed.
She was calling everyone. Warden McKee, Captain Posey.
The Constituent Services Desk, Miss Townsend, up and down the chain.
And the results of these calls are just staggering in their monotony.
Monotony is the perfect word. We have accounts of her calls to Warden McKee just going straight to voicemail, hearing the automated message, Tiffany Smart is not available to take your call.
And this wasn't just once.
No, it was repeated again and again.
And you have to think about the compounding frustration. Day after day, she's leaving these voicemails, like the one we have from December 1st.
That's day 12 of the strike.
And you can just hear the strain in her voice. She's demanding confirmation on why he had to be on a hunger strike in the first place. She's not asking for state secrets.
No, she's asking why her husband is starving himself. And all she got was silence.
And it wasn't just the administration hiding behind voicemail, was it?
Not at all. Even simple welfare checks, the bare minimum required by their own policy.
What happened with those?
She'd get passed around from person to person until the phone just rang and rang. She documented one time where the phone rang for over 2 full minutes. No one picked up.
2 minutes of silence when you're waiting to hear if your husband, who is starving himself to protest abuse, is okay. That is not an accident.
No. That is the sound of an institution wearing you down. It's exhausting her resources, her hope. She even said she was calling back just so they couldn't claim she hadn't tried.
Only to hit another wall.
Another automated wall. It is the institutional pattern. The transfers, the ringing phones, the voicemails. It's a kind of psychological warfare designed to make the family just give up.
She actually says it herself in the source material.
She does. She says,
Wow.
I'm not going to give this up, but there's no point in calling back because they're just going to keep me going in the same circles.
Astonishing. It's the bureaucratic equivalent of passing the buck while a man is, potentially dying.
And that refusal to communicate, it quickly moved from an emotional crisis into a severe medical one. This is around day 9 through 14.
The stakes just became existential.
Exactly. Dr. Traywick was initially told to call the director of nursing, a Miss Hall, to talk about his condition.
Okay, so she finally gets through to a person.
She finally gets through. And the conversation immediately implodes, not over his care, but over policy.
What was the policy?
Miss Hall refused to release any medical information at all, unless Traywick was actually hospitalized.
Well, wait, Dr. Traywick had the official authorization, didn't she?
She did. That's what makes this so legally fraught. She had the official ADOC form, the H2C, the Healthcare Information Release form, signed by her husband.
The state knew they had permission to speak to her.
Yes. But the director of nursing used the private nature of the medical services provider to completely override the state's own document.
So a vendor policy overrules a state legal form.
That's what Ms. Hall reportedly said. We're not ADOC, ma'am. We are a vendor. We don't follow their policy. I have to follow my policy.
That detail is critical. It sounds like the state has created this systemic immunity cloak for its contractors.
It does. And Dr. Traywick, who, holds a PhD in counselor education, she's a professional herself, she realized very quickly that asking for information was a dead end.
So she switched tactics.
Completely. She stopped asking for updates and desperately tried to give them life-saving information.
She warned them about his medical history.
Documented heart conditions, previous liver and kidney issues, and the absolute necessity of monitoring his thiamine levels.
And this information was crucial at this stage, right? 2 weeks in.
It was absolutely critical because she was warning them about something called refeeding syndrome.
For listeners who haven't heard of it, what is that exactly?
It's a potentially fatal medical emergency. When someone who has been starved or is near starvation suddenly reintroduces food, it can cause these catastrophic, rapid shifts in electrolytes.
So the body basically panics, tries to absorb the food too fast, and the system just crashes.
Precisely. We're talking potassium, phosphate, magnesium. These electrolyte shifts can lead directly to cardiac failure, respiratory collapse, or seizures. It can kill you.
And Dr. Traywick was trying to warn them about his specific risk factors.
Desperately trying to warn them. His previous heart strain, his history of alcohol use, all things that made him especially vulnerable to this. She was offering them a cheat sheet for keeping him alive.
And how did Miss Hall, the director of nursing, respond to this life-saving professional advice?
According to the source material, Ms. Hall simply hung up.
She hung up the phone.
Hung up after refusing to receive any of the information. So the state's policy of silence was prioritized over receiving critical information that could have prevented a fatal medical emergency.
And this wall of silence, it wasn't just limited to the spouse.
No, we see the exact same dismissive culture when Traywick's son, Z. Traywick, called in.
He was trying to do a welfare check.
Yes, and his recorded account, it just further illustrates the institutional apathy. He reported that staff, specifically an Officer L. Finney, responded with
What did he say?
rude remarks and smart remarks of just sarcasm and a snappy attitude. The son concluded, based on his own experience, that it seems to be an officer problem.
So that's external confirmation. The hostility wasn't just bureaucratic, it was cultural.
Deeply cultural. But despite this total isolation, somehow Traywick managed one brief, unauthorized call on day 12.
And what did he say?
He confirmed that Warden McKee had visited him in his cell.
Okay, so the warden did see him.
She did. And here's the truly staggering detail. The warden reportedly claimed to Traywick that she was unaware of any reason for the strike.
Wait, 2 weeks into a protest, after continuous calls and voicemails from the man's wife, a professional with a PhD, the warden claims ignorance.
It suggests it's not a lapse in communication. It suggests an official policy of denial, an attempt to minimize the issue, reduce accountability.
And how does that denial square with Traywick's own commitment?
It doesn't at all. It stands in stark contrast. On that first call, he said, "I will make them kill me." And his ultimate demand was that any resolution had to include one condition.
Which was?
That he gets to call his wife the moment he comes off the strike. That access, that communication was his measure of success.
The wall of silence was so absolute that simply getting to talk to his wife became a core demand of his strike. That's incredible.
It is, and it brings us to the formal legal challenge Dr. Traywick issued.
A challenge that carries enormous weight because of her own professional expertise.
Exactly. Her formal letter and its addendum, they outline a systemic constitutional crisis that goes far beyond just medical neglect. She argues that the ADOC's policy of total isolation,
The combined loss of everything.
physical mail, digital mail, tablets, writing materials, all of it. She argues it violates the fundamental right of access to courts.
So what does access to courts practically mean for someone who's incarcerated?
Well, it's defined by Supreme Court precedent, cases like Bounds v. Smith and Lewis v. Casey. What they basically say is that the state must provide prisoners with the essential tools.
Like a pen and paper.
A pen, paper, access to legal libraries, the tools to file a legal challenge. By stripping Traywick of every single piece of writing material and digital access, the ADOC wasn't just isolating him. They were functionally stripping him of his constitutional right to even begin challenging the abuse that led to the strike.
And her letter doesn't just stop at the consequences of the strike. It goes back to the causes.
It does. It tackles the Eighth Amendment violations that started it all. She challenges the excessive force, that chemical spray from behind, and the overall inhumane conditions.
Unsanitary dorms, pests.
Forcing inmates to eat and sleep in the same cramped, unsanitary space. I mean, all classic violations.
But there's one detail in her letter that just captures the sheer indignity of the situation.
I think I know the one you mean. Officers commanding people to stop urinating during count procedures.
It's appalling.
It's appalling because it directly flies in the face of established Supreme Court precedent. The case Hope v. Peltzer specifically condemned Alabama for these kinds of punitive practices. Dr. Traywick is using her expertise to show that this wall of silence, the denial of legal access, and the conditions themselves, they're all symptoms of a system that is operating in willful violation of clearly established law.
Let's connect this cycle of denial, isolation, and constitutional failure. Let's connect it back to the money, because that's the ultimate cost to the public.
Well, we connect it directly to the massive financial liability the state has accepted. They've prioritized impunity over accountability and communication. We know Alabama taxpayers have paid $57 million since 2020 to defend and settle lawsuits against ADOC.
$57 million.
And $17.4 million of that was specifically for 94 excessive force lawsuits. That is the quantifiable price of this systemic failure.
So that failure creates a culture where an officer, like Officer Finney, feels empowered to be sarcastic to a grieving son.
Where a warden can claim total ignorance of a 2-week hunger strike.
And where medical vendors can just hang up the phone on life-saving information.
Because the state has structurally chosen to fund the legal defense of violence and denial, rather than invest in the reforms that the strike was demanding in the first place.
It's a deliberate financial choice, then, to protect failure.
It is. And Dr. Traywick, in her letter, she detailed exactly what the state should be investing in. Services like parenting programs, cognitive behavioral treatment, trade skills, family-friendly contact points.
Things that actually prepare people to return to the community.
The very things that reduce recidivism. But instead, they're spending millions to fight to preserve a culture that is demonstrably violent and unconstitutional.
We have spent this deep dive detailing the profound human cost of silence. We've seen a wife's desperate professional calls met with a barrier that escalated a peaceful protest into a life-threatening medical risk.
And the evidence is just clear. The ADOC is choosing to spend millions defending an unconstitutional culture of denial rather than reform.
So just think about that $57 million. What beneficial, life-saving impact could that money have had if it had been directed toward a genuinely transparent system of communication?
Guaranteed medical accountability, adequate mental health care, family support infrastructure.
Until that culture shifts, and until the financial priorities move away from funding the defense of constitutional violations and toward investing in genuine rehabilitation and communication.
The human and the monetary costs to the state will only continue to rise.
We leave you to reflect on that choice. Thank you for joining us for this deep dive.